Good afternoon, everyone. Thank you for tuning in to this afternoon's Health Department briefing. We are fortunate that our tests are increasing. It's getting us a lot more information, which at this point in time, that knowledge is very helpful to us, and a lot of moving parts in the state. I don't have a lot today other than just continued vigilance. Don't slack off now. I think we all know there's a lot of moving parts in the state and a lot of noise out there, but I think the thing that it's really important for us to keep in the forefront of our minds is safety is the key. And we want to make sure that we stay safe, we keep our families and friends safe, and we allow plenty of opportunity for our hospitals to deal with this. At this point in time, I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Ardis. I begin today's briefing with the to-date totals. For the Tri-County region, we currently sit at 140 cases. That is 11 more than yesterday. There are 87 in Peoria, 41 in Tazewell, and 12 in Woodford. Again, that is 87 in Peoria, 41 in Tazewell, and 12 in Woodford. There are no new deaths to report for our Tri-County region. In terms of our hospital data, our ICU beds in use currently sit at 22, with persons under investigation in the ICU at 5, and COVID-confirmed cases in the ICU at 17. In terms of non-ICU bed usage, there are 32. I want to also share another data point in regards to our cases as well as our hospital values. In terms of trends, and we like to start looking at trends further as we go through this, but our average 7-day increase for case counts in the Tri-County is 8. Meaning that in the past 7 days, we've been averaging in that time period 8 new cases a day. In a 14-day period, it sits around 5. And this is an important number to kind of monitor and look at, because as we start talking more and more about what does reopening or relaxing policies and procedures looks like, understanding trends in terms of case count and that data is really important. Likewise, our hospital data is also very important in terms of our ICU usage as well as total bed count. And while right now in our region, I believe the Illinois Department of Public Health for the Peoria region sits at a 22% usage for bed count, which puts us in a really safe area, is one that we want to continue to monitor. And so likewise, in terms of our 7-day and 14-day period, we've seen that ICU usage has increased, but total bed count has stayed about the same. In terms of our non-ICU bed count. And so with that, we really are monitoring this and wanting to understand fully what we're seeing for our hospital systems, because they're going to be playing a huge part in terms of moving us forward to the next phase as that time comes. Going back to Peoria County specific data, of the 87 confirmed cases, 47% are recovered, 31% are in home isolation, and 18% are hospitalized. Females make up still 60% of our gender base, and in terms of our age range, we still see the highest being 30 and 39, followed by 50 to 59, and then 60 to 69. So again, all ages are really impacted by this. And in race and ethnicity, whites make up 56% of our cases, and blacks make up 39% of our cases. In addition, 39% of our cases are through our congregate living settings, and 23% of our cases have been identified through the Heartland Health Service program area. As of 3 o'clock today, Heartland Health Services reported 30 individuals tested at the Carver site and 102 at the East Bluff site. So again, just great resource to have in our community is that community testing that Heartland Health Services has been providing now 7 days a week. Our speaker for today is going to, I think, further discuss the impact of COVID-19, especially on one of our most vulnerable populations, and that's our veterans. And so with us is CW Speight. Thank you. As soon as you said that, I said Speight from Peoria Vet Center.
Afternoon. Let me tell you what Vet Center do. The Vet Centers are community-based counseling centers that provide a wide range of social and psychological services, including professional readjustment counseling to eligible veterans, active duty service members, including National Guard and Reserve components, their families, and their families. Readjustment counseling is offered to make a successful transition from the military to civilian life or after a traumatic event experience in the military. Individual, group, marriage, and family counseling is offered in addition to referral and connection to other VA or community benefits and services. Vet Center counselors and outreach staff, many of whom are veterans themselves, are experienced and prepared to discuss the tragedies of war, loss, grief, and transition from after trauma. The services that we provide are individual and group counseling for veteran services members and their families, family counseling for military-related issues, bereavement grief counseling, military sexual trauma counseling and referral, community outreach and education, substance abuse assessment and referral, employment referral, and referral to other VA services. We were located on Allen Road. We just moved right before COVID-19 hit to 5015 West American Prairie Drive, which is in the back part of the shops of Grand Prairie. Our phone number is 309-689-9708. If we don't answer your phone call, just be patient. We'll give you a call back. And how we're handling or how we are consulting our veterans right now during this time are through telephone visits as well as VA-owned video visits called VA Video Connect is how we're communicating through our veterans during this time. Now, and like I said, we do readjustment counseling. If you need medical stuff or you need to know more about medical issues, you can go to the Bob Michael Clinic. They're located at 7717 North Orange Prairie Road, which is again by the shops of Grand Prairie. Their phone number is 309-589-6800, and you'll get a computer answering from Danville. So you punch in the extension 47350. And then if you want to know more about benefits information or benefit questions, you can contact the Veterans Assistance Commission here in Peoria County. They are located at 3116 North Drury Lane by the Landmark Complex. And their phone number is 309-681-2554. And as far as I know, their staffing is like they have like 1 or 2 people in the office every day. They're rotating. And they do claims and they can answer benefit questions more so than what we can. You can call the Vet Center office if you have any questions. Part of our job is to help refer you to the right people, of which we will. If we don't know it, we'll find out. Okay? Thank you.
Any questions? I have a question for you. Oh, okay. Thank you so much.
All right.
And before we get to the question from Mayor Ardis, I know there's maybe a lot of questions in terms of the various state's attorney offices in our area that have issued statements. Just want to reiterate, on Friday, Peoria County State's Attorney will be present for the briefing, and so you can kind of hold your questions for her on Friday. But otherwise, yes.
There was a letter sent to Governor J.B. Pritzker on behalf or signed by almost 20 people in positions as yours around our city, and your signature was not on there. We I wanted to know why that is. And it's about, let me tell you, it's about the rephasing for opening up by May 1st.
Right, so the question was, a letter went out today by area elected officials urging the governor to reopen the state, and why my signature wasn't on it. I've had conversations with the group. I think they know that that's something that's important to us here in the Peoria side and in the Peoria region. I think that the governor is fully aware of the intentions, especially of almost all of downstate, to get this started. I had a couple concerns with some of the terminologies in the letter. Nothing serious, but I just chose not to sign it at this time.
What were some of those concerns, if you could be specific?
Yeah, and again, they weren't big. I think the biggest thing was the ask was to open up things back up on May 1st, and the governor's not going to. I'm sure he's considering different options, but it's not going to happen on May 1st. So I thought that was, to have the first thing you ask for, no way going to happen. I thought was, but the biggest thing, and it's really from a lot of listening to Monica, is as area leaders talk about how we're gonna make this happen, and the smart way to do it and the safe way to do it. There has to be a lot more medical metrics to it, and the proposal had 0. And so the part of what the city manager's team in economic development, Chris Setti from GPEDC, and several of us that are trying to craft something is the importance of getting the medical metric in there. And we just want to get that part of it right, so it makes sense, so the governor's comfortable with it, and so we can get this area opened back up.
So if, like Monica said, there's a rate of about 8 new cases being diagnosed a day now. Now the 3 testing sites are online. I mean, is that a rate? If it stays that way, do you be comfortable with arguing to the governor that this is our rate, this is where it stayed? We should begin to think about reopening in phases.
So for me and for most of the other people involved with that, the good part about this is I won't be making that argument. We would leave that up to the professionals to do that, and to have that comfort level that they can speak to the governor. There's also people from the hospitals that are talking about their capacities to be able to handle, if there were to be a surge, can they handle it? Do we have the capacity to do that? That shouldn't be that's not my area of expertise, and that's not something that I want to argue to the governor on behalf of.
So you'll take your lead from the health departments and the hospitals while making that argument, before making that argument.
Yeah, and I apologize that I didn't repeat your question before, but the question has been along the lines of with new numbers coming in from the testing, does that give us any more power to lobby before the governor, I guess? I'm sorry to paraphrase there, but my response is that we're going to depend on Monica and the health department officials, the folks from the hospitals and the other medical people to guide us to offer that part of the equation to the governor.
So then, Mayor Ardis, what would be kind of your call to the people of Peoria that, see this letter and are seeing different state's attorneys from across this area basically say, we don't necessarily support this? Kind of what would your call to the people of Peoria be?
So the question is what is my call to the people of Peoria with the circumstances as we know them, which are changing almost by the hour with, some of the legal issues involved with this, and what different people are going to do. I think what it does really is it just confuses everybody a little bit more about what to do. What are business people to do? Are they going to be at a disadvantage if another county opens and that type of thing? I want to reiterate, I don't have all the answers. The most important thing is to be safe, and I think that's what everybody wants to do. The business people want to be safe. The community in general wants to be safe, and I think calm. I think calm is an important equation here. I really still think that the governor's listening to us, and if he reaches a comfort level that this area of the state can potentially do something, I think he's listening. I'm not going to say he's going to do it because I have no idea, but I'm saying there's a chance to do it, and my feeling is the way to do that isn't just to run out in front of him and say, we're doing it regardless. I think it has to be very measured. I think there has to be a real good input from the medical side, and roll it out that way.
Mayor Ardis, what would be your message to some people right now? They're kind of getting frustrated. I know a lot of people are, and some people are being very vocal about
Mhm.
not wanting to comply anymore. What would be your message to just keep going?
Yeah, so the question was, what's the message to people that are frustrated? We share that frustration. As I said Wednesday, the city in any municipality under 500,000 people have not gotten one penny from the state or federal government in this regard. And it's not just a tough time, it's a brutal time, and we're hemorrhaging, literally. And we need help too. We share that frustration. So really, we're fighting as hard as we can for them. We want them to get back open. We want them to survive through this. We're going to do everything we can to help them. Again, the strategy of damn the torpedoes, we're going forward, probably isn't the best advice we could have. It's just we're working on it really hard, and I think people are finally starting to listen. Okay.
Yes.
Monica, you said 47 people, or 47% of people recovered in Peoria County. Did you give an actual number?
No, for the individuals that have recovered in Peoria County, of the 87, the count is 41 that have recovered, which is 47% of our to-date cases.
So Monica, I guess going off what the mayor said, I'll kind of ask you the same question. So if this 8 average new cases diagnosed a day holds for the next couple of weeks, I mean, is that a number you're comfortable with saying, okay, we can try a phase reopening now?
So the question is, similarly with our case count, or average number of new cases sitting at 8 per day new, does that seem that something that we're comfortable with to kind of start opening up or relaxing restrictions? And right now I would say not necessarily the number 8, but I think in general what we are wanting to see is get an understanding of what our case count is with increased capacity, monitoring that, and then seeing if we go 14 days or more without any changes, then looking at another approach. And I think it's important to recognize that the thing that's going to really dictate how we respond to this and reopen is not myself, and it's actually not the mayor or the healthcare professionals. It's the virus itself. The virus has an incubation period of 14 days. So that means if I was exposed for the next 14 days, I have the potential of becoming another case. So we really have to make sure that our timelines that we're looking at when we're looking at phases and we're monitoring is aligned to how the virus operates. By setting arbitrary numbers or dates, we're going to put ourselves in a disadvantage. My background's science, and I think my oldest is learning about the scientific method right now as part of her remote learning. And it is, you test something, you monitor it, you watch it, and then you take in the next one, right? So you have a plant, you add some water, then you add it in sunlight, and you monitor the changes effectively, because I think the mayor spoke to it really well. You don't want to go full out because it's going to be really hard to bring it back in. So you want to have a staggered approach that's comfortable and protects the health of individuals in our community.
Going off of that, we are, talking about the mayor of East Peoria is the one that kind of was the charge of this letter, and this is the Tri-County briefing, including Tazewell County. You have the Woodford County State's Attorney, speaking out today saying that he would not enforce this. As a health department, do you think that this is dangerous? Do you think this is too soon to be kind of telling people that they're making those decisions?
The question is, is it dangerous for, various municipalities and different elected officials to come out and bring comments? I think that's perfectly within their rights to do so. I think ourselves in Peoria City County Health Department, Tazewell County Health Department, Woodford County Health Department, our 3 agencies, our mission as an agency, all have the same thing in it, which is that we are trying to protect the health and well-being of our community. And as a health department, all 3 of us agree that's going to be our first and foremost mission of an agency and what we're going to be supporting. We recognize that it's not going to be siloed. We need to partner with different agencies and support that mission. Likewise, but as a health department, our stance is going to be the fact that we are tasked with protecting the health and well-being of our community. That's going to be our priority.
So do you think a phased opening does that, keeps the people of this area? You know, yesterday, for example, I remember you saying, even though you may know your health, the job of the health department is to make sure the entire community is safe. So do you believe these phased plans do that?
So the question is, do we believe that these phased approaches will maintain the health and protect the health of our community, recognizing the fact that, you know, we have some individuals that will still be at risk? And it depends on how the phases go. If they are done and using metrics and milestones that ease it in appropriately, then yes, I do feel comfortable with a phased approach. But that's going to be the biggest question mark, is that the steps that we take, are they based out of science, best practices, as well as having those measures? You know, I think that's really important. And I really appreciate Mayor Ardis, and I've had the same conversations with Chairman Rayon, with the fact that in Peoria, we also recognize the fact that our healthcare community is also our largest employers. And so not only are they economically part of the picture, but they're in a response effort hugely critical, as well as not just for our Tri-County. They see patients from the entire central Illinois and further. And so I think it needs to make sure that it's an open and honest discussion, not only from their side as an employer, but their side as a critical response agency as well.
But so as a Tri-County Health Department, is your message still right now to follow the governor's stay-at-home order?
The Tri-County Health Departments strongly encourage individuals to follow the executive orders. And because it's going to not only protect yourself, but it's going to protect the individuals around you. Case in point, again, is that contact tracing we keep talking about. An individual right now might be connected to 4 or 5 people. The further we open this up, contact tracing, being able to test capacity, that ability to do that needs to also increase as we go out more and more into the public. So for your own health and the health of our community, we recommend that you still follow through with the governor's executive order. And it is difficult. I recognize that. I have young children. I would like to be able to do other activities with them. And I know how blessed I am to have the ability to put them outside in our backyard and play around. I know families don't have that options. It's a lot of stress in an individual's life, and we completely understand that. And we're not asking this to just be, kind of, hey, could you do this for us? It's really because of the seriousness of this virus.
So since the beginning of this pandemic, there's been a coordinated response between Peoria, Tazewell, and Woodford counties, and you've all kind of put out the same messaging. Now with with Greg Minger's guidance saying that, bars, businesses, he's not going to enforce the order, basically. So how does this change your coordination with Woodford County? I mean, is it still the same amount of teamwork? I mean, because now Woodford County is following different procedure than the other 2 counties, correct?
I can't speak directly to the Woodford County State's Attorney, and again, I think those are questions that would be better suited for the Friday briefing. But I can say that with Woodford County Health Department, we work in very much coordination with them. When they have new cases, understanding the size of their health department, they're one of our smallest health departments in our county, in our state, and then the support to provide them to help with contact tracing, that's not going to end. As well as our response with our critical hospital systems. Our hospitals, the patients from Woodford County come to Peoria County as well. And so we're going to continue that conversation and that support. Our EMAs are working together, our health departments and our healthcare coalitions are working together, and also our social service agencies. The United Way has played a huge part in supporting our social service agencies that fall in that Tri-County region. And so I don't necessarily think this is going to change our response or our coordinated efforts. Is it something that's going to be discussed amongst all of us? I think so. But at the end, our response is still focused on protecting our community.
So if this letter made it to the governor and he just decided to change his mind, and maybe he did want to start opening in phases by May 1st, you as a health expert, would you agree? This still would be his order. He is the governor. Would you agree with that, or would you think that was a bad choice as a health expert?
I think what I've noticed in the question of if the governor opens up on May 1st further, will I be in alignment or disagreement with those decisions? What I've seen so far, and that's been really supportive, is that the Illinois Department of Public Health has had a very strong role in this response. And they've been using science and facts to assist with them. And I feel comfortable knowing that the measures that they are looking for have been helping direct some of this discussion. The fact that our labs in our state were one of the first to get the testing available, the fact that we were able to, compare to relatively large-scale cities, be able to control this in the capacity that we didn't have to open up McCormick Center all the way. All of those are great indicators about the fact that using facts and data to make those decisions has led us really well and strongly here in Illinois. And so the governor has been utilizing that and been referencing it repeatedly. And so I would feel comfortable knowing that the role of Illinois Department of Public Health in this response has been really well done. And if they change the direction or want to open up broadly, I think they're going to have the data to support that.
Monica, kind of on a different subject here, nurses around the state are saying that they're going to go on strike. Do we have any concerns locally about that?
That's a great question. The question is about nurses going on strike. I think that's more suited for some of our healthcare communities to respond to. The nurses play a critical role in our communities, and I appreciate all they're doing in this response efforts. So.
And I've also been talking with some individuals, and they believe back in December, November time that they may have had COVID-19 because they had the chills, the fever, the trouble breathing. Is that possible that it was here during that time and it just really wasn't noticed?
So the question is, in the December time period, a lot of people had similar symptomology of COVID-19 and feel that maybe they had been exposed already, and could that be possible? What we found in California was actually the first death that was attributed in one county for COVID-19 was actually 2 weeks earlier than they had thought, in cities as a whole. But I think that's the important thing to recognize about COVID-19 and coronaviruses is that their symptoms are very familiar. They're influenza symptoms, fever, cough, chills, headaches. And so, again, until we get better testing in, especially antibody testing that's more accurate and understanding of that, we wouldn't really know in that cases. But I would hesitate people to assume they've had it. And even the individuals that have had it to assume that they're now immune to it. We're learning more and more that it doesn't necessarily behave like other coronaviruses. And so, again, just really continue to practice those proper hygiene practices.
Is the health department giving any kind of guidance to local hospitals? I know the modified EO allows the resumption of elective surgeries. Is there any guidance coming from local health departments on the resumption of elective surgeries at our local hospitals?
So the question is, in terms of bringing back elective procedures or surgeries at our hospital systems, the role of the local health department. We communicate twice a week with executive leadership from both healthcare systems, as well as our federally qualified health center and our university's medical school here too. And most of the direction is going to be coming from IDPH, but is recognizing that locally what the impact is in terms of PPE or protective personal equipment. What does that mean in terms of hospital capacity beds? Again, if that's one of the measures we're looking for in terms of reopening, what does their normal look? What can they expand upon further? And so, not necessarily giving them absolute direction, but helping provide them with even a conduit back to the state to making sure if they have concerns about things that are now required, how does that actually come into practice here locally?
And with the current usage of ICU beds and the current levels of PPE, I mean, is there enough of that to go around to begin the elective surgeries, which are a major revenue source for local hospitals?
So the question is, in terms of bed capacity and PPE, how do the hospitals sit in terms of going back online with certain elective procedures? And I think they're monitoring it. They recognize the fact that the slowly they open up, they're going to also have to have those measures to say, okay, can I go to the next step, or do I need to pause here as well? They're also somewhat reopening on a smaller scale than we are thinking about on a larger scale. And so likewise, they're going to be continuing to monitor and create those measures as it goes. Well, thank you, everyone. I'll see you tomorrow.